Thanks everybody again for being online. I'm so excited these are getting recorded. We're going to get into the third, and I'm thinking the final part of the New Medicine Foundation hormone description. Hormones are a hot topic out there. Everybody knows their hormones are out of whack, whether it is a woman going through menopause or a man experiencing fatigue and depression, anxiety issues known as andropause, even in our children and in everyone developing all illnesses. Hormonal imbalance is a huge part of what's going on. We did touch on the first two pieces the last few weeks. Tonight we're going to get into the adrenal glands and try to go all the way through the rest of the pyramid and describe really how simple it is that our hormones are imbalanced, and but how important it is as to why they are imbalanced and how to get them truly corrected. Because again, the traditional model, the modern medicine, Western medicine, allopathic, MD, and medical doctor and osteopathic-based medicine has no concept of really what's going on with hormones. They're so over-specialized, they're so focused on synthetic drugs and surgical treatments that actually make these hormonal imbalances worse. So to start off, from where we were last week, a real brief picture again. I'm going to try to get this wrapped up in 20 or 30 minutes. I think that's everybody's attention span, including my own. We talked about the importance of these hormones and why it starts right here at the foundational level of the testosterones in men, the progesterones in women, the estrogen dominance. That is epidemic, it is ubiquitous, it is in everybody until proven otherwise, it is present at birth, it is from the toxic exposures, and that is the foundational hormone that is deficient. It starts to pull the entire pyramid down, and as life and stress and illness and toxic exposure and the effects of the modern world wear us down, the deficiencies stretch all the way up through to the top, to our central nervous system, our pituitary and hypothalamic glands. And the more deficient we are, the worse we feel, the sicker we become, and the more at risk for chronic illness of all kinds we are. So the next hormone in line, the next gland in line, is the adrenal gland. This is becoming a well-known topic today. I think about half people out there know that adrenal glands are a big factor in our health, but we don't really know the truth behind them, as we don't about the foundational hormones, the androgens and estrogens. The adrenal gland is an incredibly important gland in our body. It is really the quarterback of the entire HPTAG axis, the entire balance here. The adrenal glands, they are our stress, our fight or flight gland. It's the gland that when we feel scared or anxious, or we need that burst of speed to outrun a lava flow or attack an attacker, or in the natural world, it's the gland that lets animals always be ready to defend themselves. It secretes cortisol, adrenaline, that rush of energy, epinephrine, aldosterone. Now, we're told a lot of misinformation, as we are with most hormones and most health problems in the media. We do not all suffer from high cortisol in our current states. I will discuss the 3 stages that I describe adrenal fatigue in, and that cortisol is typically actually deficient in us. So all of these TV ads, if you see it on TV, it's probably wrong. Cortisol is not in excess. Cortisol is not the fat hormone. Cortisol is not why we have big bellies and big spare tires and problems with obesity. It's cortisol deficiency that's more of the problem, as well as all the other hormones that are involved. So the adrenal glands being the quarterback, when the foundational hormones become deficient, the adrenal glands can step in. Think of this as the center on the football team, and the center gets taken out. The QB can block while he passes as well, but it's going to make him a lot more tired a lot more quickly. So this epidemic deficiency down here only wears the adrenals down that much quicker. They can come in and produce these hormones to support what the gonads are not doing, but it just stresses them out even further. They're already overstressed with all of the stress we feel in this world. Mental stress, physical stress, chemical stress, the stress of the modern world that is so unnatural. They're stressed out. We are stressed out, and our adrenal tests show it. So getting into that, adrenal stress is a huge component of our health, and it's just like the androgen deficiencies, it's truly pandemic as well. It's in nearly everyone. Everyone is experiencing adrenal fatigue and stress. It's just a question of how much. So I call it a secondary pandemic. The testosterone and progesterone deficiencies are really the primary deficiency, but very, very quickly on in life, the adrenals are going to become stressed too. So we get saliva tests. We require it now of our counselors, and we recommend it highly for anybody as it's part of the basic treatment plan of new medicine. I don't really like to treat anybody without knowing what their adrenals are doing because it's a huge part of how they feel and what's going on in their body. About half of the people out there have significant enough adrenal fatigue problems already when they come to us because they don't feel well, that it needs to be a significant focus of their treatment. Both males and females affected. And again, with all of those hormones that adrenal glands produce, the cortisol that controls blood sugar, the aldosterone that controls sugar, salt balance, the adrenaline and blood pressure regulating things, they have huge effects on our health, our immune system, our energy, and our mental status, as well as our physical status. I like to categorize the adrenal fatigues in 3 stages. And again, with all of those hormones they produce, the important position they have as the quarterback of the hormone system of the body. They are incredibly important in energy, inflammation, sleep, vitality, illness, you name it. They typically take quite a few years to wear out. People will be at a number of different stages of adrenal fatigue, whereas the testosterone and progesterone deficiencies we see wear out pretty quickly now in our children. Adrenal fatigues will progress through these stages, through decades, and they can recover, but it takes months and years also, and it's a multifactorial treatment plan. Once we get someone balanced biochemically and hormonally and nutritionally and mentally and physically, you've got to stay balanced because your adrenals are always going to be there doing their job. So incredibly important, incredibly, incredibly ignored by traditional medicine. They think the adrenals are either on or they're off. If your adrenals are off, guess what? You're near death, and that's a horrible place to be. They don't think there's any other real adrenal status. They're either working or they're not. Well, we use saliva testing because, again, it's a much more accurate test, and it's going to show us a couple different key markers that describe what our adrenals are doing. At the heart of it is the cortisol rhythm, and very quickly I'll progress through this. These are great tests. Cortisol is nice and high in the morning. As soon as we wake up, our adrenals wake up for us. They excrete a lot of cortisol. That raises our blood sugar, and whether we have eaten or not, that allows us to feel the energy to get up and get out of bed. It's like starting our car. It's somewhat of a stressful experience, but our body's ready to do it. The number one obvious symptom of adrenal fatigue is trouble getting out of bed in the morning. That person that says, I can't get going, I need more than that normal 1 cup of nice organic coffee, I need 2 or 3, it takes me an hour, I'm achy, I'm stiff, my brain's foggy, and it's because, like this person here, look at this cortisol level here. This is the range it should be in. Her cortisol is what I call flatlined on the floor. This is stage 3. Stage 1, we'll see just morning low levels of cortisol, and then it might be okay the rest of the day because it just can't keep up with that morning dose. Stage 2, it starts to get lower, and the overall output will get down in the teens, and this is stage 3. This is really, really severe cortisol deficiency. This is a woman who has severe illness, and she's just not producing any cortisol. So again, cortisol lets us get going in the morning, and another real quick topic about cortisol and why it's low in everybody and not high. Cortisol raises blood sugar. Cortisol is low in everybody. Cortisol deficiency adds to the sugar and carbohydrate cravings that we all have that contribute to then high insulin levels, high sugar levels, obesity, diabetes, you name it. So again, the media tells us high cortisol, it's the opposite. And I'll explain stage 1 in more detail on the next slide. Interestingly, at night, cortisol should be nice and low. We're going to bed. We don't need a lot of blood sugar. We're going to sleep. We don't want a lot of brain sugar energy. But you know what we do these days? We stay up late. We watch TV. We are wired and tired because we've had way too much stimulation through the day with typically caffeine, nicotine, medications, a lot of the toxins in our systems, the estrogens and insulins actually, and even I think leptin are going to be shown to be excitatory. They keep us awake. So we're awake, but our cortisol is low, and guess what our brain tells us to do? Go eat sugar. So we're standing at the fridge door, we're looking for the ice cream, and that is part of the problem. So when you get the adrenals balanced and feeling better, you get the levels higher in the morning, even if it needs replacement. You let them come down at night. Naturally, you teach people to try to get to bed, eat better foods, and you rebalance the whole system, and you get away from those strange cravings. all part of hormonal balance. That is the wonders of how people come through treatment with new medicine and say, oh my gosh, my cravings are gone. I can eat normal food. This is incredible. Adrenals are a big part of it. So stage one is in everybody, and you don't feel stage one. Stage one is you're stressed, your body's keeping up, you're young, on the test we might see a little bit of a mid-range of DHEA, but cortisol is high. No symptoms really. People feel good. The cortisol's high. High cortisol does feel good. People know that are ever put on synthetic steroids that are very, very dangerous because they're so toxic and strong, like prednisone. Typically, you have a burst of energy and you feel good. Well, people are naturally in this state. We are in the fight or flight stress response at all times. The world is way too stressful. Our bodies are feeling stressed all the time, and that's not normal. So we're all there. You don't typically get sick there. You typically are just dealing with it, and you're doing okay. We just try to support the body where other things are deficient, and we alert people to the fact that their body is in a state of stress, but the good news is it's keeping up. Stage two is where you start to feel ill. Cortisol starts to taper off, and people are going to start having symptoms. They're going to start feeling fatigue, brain fog, sugar cravings, weakness, increased inflammation, salt cravings, you name it. They're going to start getting sick. I went ahead a little too far there. If you can get on top of the adrenal glands in stage two, that's great to do because you're going to avoid going to stage three where that patient was that I just showed you on the previous test. And I'm going to jump back a slide here as soon as this stops going forward. Stage three is where you don't want to go, but if you do, that's okay because you might need some bioidentical replacement. We know how to deal with that, and we will. But in stage two, that's typically, stage two adrenal fatigue is typically a large part of when people start to develop true illness of all kinds, both psychiatric and physical illness. It's these hormonal deficiencies that we see right there on the saliva tests that are really very easy to quantify and correct. So symptoms are appearing, the hormones are declining, they're going to show up negative on these tests, they're very accurate, and it's part of why people don't feel well. They're not developing an illness that they're genetically destined to get, that all of us now are genetically destined to get. We're having stress and deficiencies, and we need to get them corrected before we progress on to stage three, which is really the end-stage adrenal fatigue, like the test showed that we had in the previous slides. Cortisol is flatlined. We don't test for aldosterone yet. It's not available, but most likely aldosterone is low as well. And DHEA is a good marker of the adrenal glands. It's coming down very, very low. So this is where someone's going to have typically severe illness, either mental or physical, autoimmune diseases, chronic inflammatory problems that are a part of Alzheimer's or cardiovascular illness, heart attacks, strokes, severe arthritis, osteoporosis. These are all inflammatory problems and hormonal deficiency problems. Also mental problems, depression, fatigue, anxiety, trouble sleeping. Our hormonal balance is really all messed up. So low cortisol levels, low aldosterone levels, low DHEA, low hormones don't feel good. They make us sick physically and mentally, and it's amazing that the modern medical model does not recognize this. In someone with stage three that has severe illness, we come in and we prescribe bioidentical cortisol. And when I first learned this from my mentors, Steve Hotze and Mark Hyman years ago, I said the same reaction that a lot of traditional doctors and people probably have, which is, hey, that's ridiculous. We have too much cortisol. I've seen it in the media. Well, you know what? We have too little. It's right there in the testing. And cortisol is one of the things, and about half the people we treat, after we've replaced the foundational hormones, when we replace bioidentical cortisol for a short time or a long time, whatever's needed, it can be miraculous. Autoimmune illnesses, fibromyalgia, hearing deficiencies, aches and pains, sleep problems, energy problems, brain fog can disappear within a day, if not a few days. So it can be miraculous. It's very safe. Completely different, as all bioidenticals are, from synthetic steroids. Medrol dose packs, prednisones, prednisones are all synthetic, extremely toxic, shut down the immune system, way too much cortisol-like effects. We use natural. The body just assimilates it. It's very safe. You can't, I don't even know if you can take too much, but certainly we don't try to. If you do it, you're not going to hurt yourself like you can with most medications. So again, when you know how to balance adrenal glands, and this is something that just isn't intuitive to most doctors because of the information out there, it's phenomenal. But the adrenal glands and cortisol are such important parts. I'm looking very intently for testing and pharmacies that know how to compound aldosterone. There's some research that aldosterone deficiency may have a huge part of hearing loss, and it makes a lot of sense the way hearing works in the body biochemically. So again, we're looking for more and more answers on just naturally getting the body balanced, and adrenal glands and cortisol are a huge part of it. We talked a bit about DHEA, big fancy word, dihydroepiandrosterone. It's a marker a lot of people are familiar with because it's over the counter and people really misuse it. They take too much. That's not the way to do it. You want a standardized form. It needs to be blended as we do with all of our primary hormonal replacement products. It really just supports the adrenal glands, which can then take DHEA and do what they want with it. If you take hundreds and hundreds of milligrams over the counter, your body will do things you probably don't want it to do. It can wind up converting over to testosterone in a woman or estrogen in a man, or you don't want to take a lot of it. It is a very important marker, though, to let us know how the adrenals are doing in general, and it's an important precursor hormone to replace in most people at the right amounts, blended with the other hormones that we blend. So very important marker to look at, but again, it's not a cure-all, and you should get it from a reputable source at the right amounts so it doesn't convert to other hormones. Extremely well tolerated in pretty much all men. About 20% of women might convert it to testosterone and have some testosterone-like effects that are very easy to tell, and we just simply remove it from their prescription. So we're doing great here. We're gonna rip on through the rest of the hormone talk in the next probably 10 minutes and talk about a good one that's near and dear to every woman's heart, which is menopause. We touched on it a bit in parts 1 and 2. So I would recommend anybody getting into this talk who wants to know a lot more about the foundational, make sure you listen to parts 1 and 2 of the NMF hormone talk first. But menopause is a natural process of life. It is wonderful because the hormonal swings that allow for pregnancy go away. The problem is that instead of both estrogen and progesterone levels decreasing naturally through the menopausal process, we're all estrogen toxic. Our progesterone levels decrease significantly. They're already deficient. They become even more so deficient. The adrenals become even more involved and become more stressed out. And as we progress through menopause, we become even more hormonally imbalanced than we were before. Traditional medicine treats it completely incorrectly. They often take out the uterus or the organs that are the most affected, and they replace more estrogen in the woman's body, where that is the problem to begin with. What needs to be done, hopefully before the uterus, or interestingly, the prostate is the same problem in the man as the prostate becomes enlarged. Before these organs become that sick, we should discover the estrogen and progesterone or testosterone imbalance, reduce the estrogen levels, replace the progesterone levels, and wouldn't you know, the problems go away nearly immediately, very quickly. So this is one area where women and men with their prostates have been so mistreated for decades with all the hysterectomies and the prostate treatments and removals. And you know what? The cancer rates just keep going higher and higher because we're not getting to the root of the problem. If we can get these things balanced beforehand, we won't have all of these uterine and prostate problems. It's incredible, and it works. And it's all about restoring that estrogen and progesterone balance in a woman or testosterone in a man. As I said, the adrenals become involved because they are that next gland to get involved with the deficiencies. And again, these problems are in everybody. They're hormonal imbalances. Menopause is not an illness. It is just a process of life that we're just not going through naturally. We've got to get the excess estrogen out of the body, replace the progesterone, restore balance to the adrenal system. Similarly, in men, andropause. It's a new term about the last 10 years. However, it is not, again, an illness. It is not something that just all of a sudden happens to a man. It is present in every man because every man has these same hormonal imbalances. Estrogen dominance, again, from the sources we talked about in the first 2 parts of the program, and testosterone deficiencies. It's epidemic. It's in everybody, and it doesn't feel good. The adrenals come in, and men basically feel premenopausal all the time. So ladies out there should feel bad for us because, and they know it to be true, that men are hormonally imbalanced all the time, and it's really very simple. It's this same problem that's very similar to menopause that happens to just get worse in women during menopause. It's andropause, and it's now happening in our children because they're testosterone deficient at birth, they're estrogen dominant from the toxicities and the gland failures, and look at what's happening to the little boys out there. They're having trouble with puberty, they're not developing correctly, they're getting obese, they're having all those estrogenic effects, they're developing male breasts and small anatomies, and mentally they're having a lot of problems as well. So it's really simple to explain it. And every child who becomes symptomatic of some kind needs to be tested. They don't all need to be have hormone replacement. Typically, if you can get a child diets cleaned out and their life cleaned out, as they hit puberty, their body's going to take off, and the girls are going to produce progesterone, and the boys are going to produce testosterone, and they're going to develop normally. But more and more these days, that's not happening because the world's getting more toxic. The medical community is mistreating it, and the information is just not there. So we've got to get this information out there. It's for all of our health, especially the youngest generation. We treat when their symptoms become life functional problems, and they're thinking about medications or they're having severe problems. I've had children who are suicidal as they're going through puberty because we recognize it as a hormonal problem. The parents are smart enough to not want to use medications, and we simply step in, provide the natural hormones that are missing, and the children blossom through puberty and mentally and physically just return to normal. It's pretty exciting. To wrap up the hormones, the thyroid we touched on, that's a very important gland that controls metabolism and energy. Deficient in about half the people out there. Needs to be optimal range. In the optimal range, which is very tight range, TSH is the marker, 0.8 to 1.0. Again, modern medicine thinks it's this wide range, and you're not low thyroid until you're way out of range, and I'll tell you by that time you've got a lot of other problems. So we optimize thyroid. It's one gland that can respond very nicely to new medicine treatment without replacement. About half of the glands out there will improve about 50%. So if someone's not severely deficient, we'll see what their thyroid does afterwards. But everybody's unique. If there's homocysteine problems or severe weight or energy problems or other signs of low thyroid, we'll go ahead and replace it. Again, with bioidentical, there's a lot of good forms. We have our own compounding pharmacy providing a very well-blended form now because Armour's disappearing. And of course, bioidentical is always going to be better for the body and better tolerated than the synthetics out there. We also, of course, check T3, T4 levels, antibodies, you name it. We see them all correct naturally or with a little bit of replacement. If you remember from the hormone pyramid, growth hormones up at the top, produced in the central nervous system, very resilient. And the misinformation with growth hormone is really in the anti-aging versus natural aging world. Anti-aging clinics, of which there are many and many groups, think that growth hormone is good for everybody. We disagree. We find that about 25% of people have a severe deficiency that needs to be replaced, and when it's replaced, it can be miraculous. But growth hormone drops as insulin increases. It has an inverse relationship. We check it with IGF-1 as the marker, insulin growth factor 1. And if we get the insulin down, which we always want to do as we lower weight and we reduce body size and we reduce diabetic tendencies, we'll see growth hormone come back really nicely about 3/4 of the time. That, to all of my friends here, is natural anti-aging. That is really exciting to see. We will see growth hormone levels double naturally in a course of weeks, and that's just phenomenal. So whatever hormones we don't have to replace, the better. But there's some, as we just talked about, the hormone pyramid that we do have to replace. They need to be done correctly, bioidentically, and at the right levels with the right testing. It's tremendously important. To health, both physical and mental. One of the most misguided specialties out there, I think we can all agree, is psychiatry. There is not one psychiatric condition that has any scientific evidence or test to prove it. And the psychiatric diagnostic book is increasing exponentially. There are thousands of psychiatric diagnoses now, and we don't believe in a whole bunch of them because we know that at the root of our mental fatigue and depression and anxiety, it's a lot of things, but these hormonal imbalances, until these are fixed, I wouldn't want to give anybody any kind of dangerous mind-altering medication because I know these hormonal deficiencies and imbalances are at the root cause of most of these problems and the reasons why most of these diagnoses here and so many others are being applied to people exponentially along with all the dangerous medications. So we need to get out there, and psychiatry alone is a great talking point to try to help people, because you will feel so much better when you get hormonally balanced. And it's as simple as 2 saliva tests and getting on the right natural products and getting away from all of the dangerous medications they're using, because these medications are dangerous. Talk real quick about fatigue. We're all fatigued. How much are we addicted to the energy drinks? They're getting bigger and bigger, more and more potent. I think there's 5 cups of coffee in one of the large energy drinks now. I enjoy a cup of organic coffee every morning, but 5 is a bit ridiculous. And we are hooked on these energy drinks because we do feel fatigued and tired. And the #1 reason is hormone deficiency. All of the hormones we talked about, when deficient, will make you tired. The androgens, the adrenals, the thyroid, growth hormone, cortisol, you name it. So everybody feels this fatigue. Everybody needs to, again, have hormones looked at, which is why everybody should have a new medicine evaluation initially. And again, this isn't something we have to do repeatedly. Typically, we only need 1 round of saliva tests. So important to get that information and get it balanced. Don't abuse caffeine. In moderation is okay. Should be organic. Of course, we need proper sleep. It's all part of being hormonally balanced at all returns. With that slide, that wraps up hormones. That's a great bunch of information. I really thank everybody for listening. A couple good parts to bring people to listen to. Of course, we really believe in using standardized products. Our Pure Cell products are made by pharmacies we trust. I can't tell you how many times people come to us, pretty much every time, from another pharmacy on another compound. Even with our prescription, it's just not made right. So it needs to be tested right, prescribed right, with correct products. So thanks for listening to all that. That's a bunch of great information. I had a question here about melatonin. Melatonin is from Donna. Thanks, Donna. Great question. Melatonin is another hormone, relatively new, that we know comes out of the pineal gland in the central nervous system, relates to sleep, can be used for sleep. We know it's secreted at night. The research is pretty new on this. There's some contradictory evidence that it may be safe to take in high amounts because it only relates to sleep. There's some evidence that, hey, this is a hormone and it's doing things that we don't really know yet. I think my gut feeling from the research I've seen is it's pretty safe. I think 15 to 20 milligrams is quite a bit. Typically, melatonin it used to be prescribed in micrograms, 1 to 3 micrograms. I think 1 to 3 milligrams is probably safe. I think 15 to 20 milligrams sounds like a lot. But certainly I think a little bit of melatonin can be taken safely to help with sleep if we don't get good improvements in sleep with just the basic things that we do with new medicine, because typically we see with the basic hormonal balancing we do, just with really the foundational level of the androgens blended with DHEA when appropriate, usually that, along with detoxifying the stimulating chemicals and hormones out of the body, is usually enough to start restoring sleep pretty significantly. But certainly if not, yes, melatonin can be used. There's a lot of other good products that I tend to gloss over because there's not a lot of scientific background to it, but that's where a counselor can come in and say, you know what, try some valerian root, try some passion flower, of course chamomile teas, good sleep hygiene, good daily hygiene. All these things can be helpful for sleep. But really, for me, the power of getting that initial hormone balance deficiency corrected is really where it is for me. I think we're at time up. I really appreciate the listening again. Please share this information. We need to get this just truthful information out there because there's so much misinformation. That's such a big part of why we're being guided down the wrong path of medicine. Doctors don't know it, both the traditional docs and the docs way out there in the alternative fields of anti-aging that really don't have that much scientific background at all. We need to get on the same page that you naturally balance these hormones, you get the appropriate and accurate testing and information, and you do it the right way.